On alert round the clock. Detailed mechanism to solve civil servants' wage issue and amendment to reinforce IBET. Those are the headlines for tonight. You're now with me, Shal Chamato, and this is TVS Nightline. Sarawak Fire and Rescue Department are leaving no stone unturned in their preparations for the upcoming monsoon season. As such, patrols to high-risk areas have been done, with flood-prone areas have also been identified, with observations made statewide. Reports showed that focus are towards the central region of Sarawak, namely in areas such as Sibujaya, Selangau, Kanawit, Bintangor, Song and Cebu Central.
Moderate rains occurs in the area, with daily activities still ongoing as usual, despite the minimal rise of water that had covered some roads. While at Song, it was reported that after a heavy downpour that lasted for 4 hours, the Rajang River and Katibas River's water levels are under control with no risk of flood. While in Selangau, Kanawit, Bintangor and Sibujaya, weather are reported to be cloudy, with situation are under control. The public of the areas are advised to be on the alert and inform the authorities should a flash flood occurs.
The Immune Belt Enforcement Team, or IBET, has expanded its authority, where the members of the team are free to search and identify any wild animals found to be infected in each of their own region. Minister of Food Industry, Commodities and Regional Development, Dr. Stephen Rundi Utom, said that such authority will include amendments to the Veterinary Public Health Ordinance of 1999. The purpose of the amendment of the ordinance is because of constraints in terms of manpower of the Sarawak Veterinary Services Department, DVSS. The state government takes the initiative by approved to 32 IBET teams across the country's borders be given the same authority to facilitate the coordination of enforcement. Meanwhile, the main tasks of the IBET team include target removal, movement surveillance, vaccination, collecting demographic data, and educating the general public as first responders in rabies disease control. In line with the nation's economy, the welfare of civil servants should be prioritized, as civil servants are indeed the heart of the country's administration. Premier of Sarawak, Dato' Padigi Tan Sri Abang Johari Tunapeng, is aware that the current wages for civil servants should be looked into. As such, the Sarawak government has visions to undertake the best mechanism to have the right minimum wages set in order to upskill the employment system in the state. The much-anticipated national-level Bintang P. Ramlee and Bintang Kecil singing competition will be making a comeback this year. According to the Director General of Broadcasting of Radio Television Malaysia (RTM), Datuk Cik Roslan Cik Daud, the event will take place at the Sarawak State Stadium on 22nd October and 24th December, respectively.
Pertandingan akhir Bintang P. Ramlee dan juga Bintang Kecil. Bintang P. Ramlee akan diadakan pada 22 Oktober nanti, dalam masa yang terdekat ini. Dan juga Bintang Kecil pada 24 Disember 2022. Kedua-dua program yang kita atur ini adalah merupakan mendapat kerjasama dan bantuan erat daripada Kerajaan Negeri Sarawak, terutama sekali daripada Yang Berbahagia Tun lah. Yang mana akan diadakan di Stadium Perpaduan di Kuching, Sarawak. Kedua-dua program tadi.
He told reporters after paying a courtesy call to the head of state, Yang di-Pertuan Negeri Tun Pehin Sri Abdul Taib Mahmud, at the latest residence in Demak Jaya, Kuching on Thursday. According to him, the competition is a platform to revive interest in the songs by the late Tan Sri P. Ramlee, who is revered as the country's greatest artist. Theme: Night of 1,000 Stars. The competition will be hosted by Azrul Zaidi and also features guest singers Bob Yusuf and Farhan.
In Kuala Lumpur, as this would affect the current situation and system of civil servants in the state. In addition, Sarawak needs to have a solid financial source to ensure the well-being of civil servants. Earlier today, the move by the Congress of Union of Employees in the Public and Civil Services, QPACs, calls for a month's bonus for civil servants when tabling budget 2023 on October 7th.
The Chinese Muslim Welfare Association Sarawak Kuching branch plans to build a cultural center to showcase the uniqueness of the community's culture. Pakdi's President Murtada Lau Abdullah said the official date for the center to be opened to the public is yet to be determined. However, planning stages are underway. He disclosed that the official site for cultural center will be located at Jalan Diplomatik Putrajaya, Kuching, opposite Sekolah Menengah Kebangsaan SMK, Demak Baru.
Murtada revealed that the state government has allocated a total of 1.5 acres of land. He said that before the construction begins, the site must be prepared by professionals to ensure that it is safe to work and ready to use.
The cultural center will get the detailed layout plan approval. We are going to submit the architectural plan, the engineering plan, and a mechanical engineering plan. Only all the relevant plans approval, and then we can start to do the building, to do the construction. Yeah.
Still under design and build stage.
Still under design, yeah.
He told reporters after paying a courtesy call to the head of state of Sarawak, Yang di-Pertuan Negeri Tun Pihin Sri Abdul Taib Mahmud, at his official residence on Thursday. At the same time, he expressed his gratitude to Sarawak's governor for approving land through the state government. He hopes that the cultural center will symbolize the value of religious tolerance in the state and country, which is multiracial, multicultural, and multi-religious. In addition, he believes that the cultural center supports efforts to uphold civilization and cultural values that are harmonious and cohesive regardless of religion.
About 60% of federal roads in the country have expired service lives and are in need of urgent repairs. Senior Works Minister Dr. Sri Fadila Yusof said the repair works will cost approximately 3 billion ringgit.
Taking into account the high costs, Fadila said the ministry is holding negotiations with the concessionaires and also getting feedback from all the ministries to plan for the construction and repair of the roads that had expired. Meanwhile, Fadila said an additional allocation of 130 million ringgit had been approved by the Ministry of Finance on September 13th for the periodic maintenance of pavements on federal roads throughout the country. He said all allocation have been offered to contractors in Peninsular Malaysia through 180 works worth 113 million ringgit, while 17 million ringgit was channeled to contractors in Sabah, Sarawak, and Labuan through 17 works, adding that the projects are expected to be completed by November.
Since August 1, 2020, the wearing of face masks was made mandatory to curb the fast-spreading COVID-19 virus. However, effective Wednesday, September 28, the Ministry of Health MOH announced that the use of face masks indoors is now optional. Health Minister Khairi Jamaluddin, when announcing the matter, said, however, premises owners could still determine whether visitors were required to wear one. He said the decision was made based on an assessment of the COVID-19 situation, as well as taking into account the current needs. In spite of that, Dr. Chew Kian Peng, an occupational health doctor, is of the opinion that the use of face masks should still be practiced for certain scenarios.
I think all these are still crucial for us to prevent virus infection. Wearing masks, hand hygiene, avoid crowded places, those general precaution is still very important. It's just that maybe, for example, wearing a mask. If you are high-risk people, let's say if you are elderly and you have many medical problems, so you know that your immune system is not that strong, then probably you have to be more cautious, like going to a crowded places. Maybe you should wear a mask to protect yourself. At the same time, our community, we should practice wearing masks also whenever you are not well. We can learn from other countries. For example, like Taiwan. Even before COVID, if you travel to Taiwan, you'll find that many people are actually wearing masks in the public. The community actually practice wearing masks whenever they are unwell. So if you are unwell, you wear mask so that you protect others. If your immune system if you feel that you are weak, then probably you can wear a mask too to protect yourself. Of course, other measures like hand washing, avoid crowded place, that should always we should always bear it in mind, so that it reduces the risk of getting infection.
Meanwhile, Dr. Chiu opined that for healthy vaccinated individuals, the wearing of a face mask is not as crucial.
Majority of people already get vaccinated, and then a lot of people also get infected. Those who hasn't get infected, probably you belong to the groups that will never get this kind of infection, or at least you are more resistant to the infection. So compulsory wearing mask indoor, outdoor, at this point, probably not that important anymore. But of course, under certain special condition, one should always wear a mask. Like I mentioned earlier, if you are elderly, you have medical problem, your immune system is not that great, you should wear a mask whenever you go to crowded place to protect yourself. And for healthy individual, I think that is not so important. And for those who are sick, you should wear a mask too to protect others. Also, when you are sick, you actually shouldn't go to crowded places because you know the opportunity for you to spread the whatever infection you have to others is higher.
Adding further, he said that the easing of restrictions does not mean that the public can take lightly the risk of infection. The government made the use of face masks mandatory on August 1st, 2020, at the peak of the pandemic, which has so far claimed 36,255 lives and infected 4.7 million people in the country. On May 1st this year, the country removed the requirement for face mask use outdoors.
To wear or not to wear. As COVID-19 restrictions ease, this will become a new concern for travellers, as the Malaysia Health Ministry announced on Wednesday that the use of face masks will no longer be mandatory on the plane. Although the mask policy is coming off, it is still common for people across the nation to don face masks both indoors and outdoor settings for various reasons. Some people find it inconvenient to put them on and off again as they commute, while others continue to wear them to protect themselves and their loved ones. And certainly many Sarawakians are having mixed feelings about the new ruling. Here's what locals have to say about it.
Kami happy lah, kini tok kita dah perlu pergi pakai mask dalam belon sebab berasa rimas. Kita kan jarak kita dengan orang sebelah kan terlalu dekat. So time kita makan pun kita perlu buka. Kayak apa guna kita nak pakai mask git lah kini tok.
Kami rasa setuju apabila penggunaan mask tidak diperlukan dalam kapal terbang sebab kami rasa bila kita dah masuk fasa endemik tu kami rasa lebih selamat untuk menggunakan mask.
While some found joy in fitting in with the new norm, there are also those who are still hesitant to take off their face masks inside a plane.
Bagi kami setuju sebab even though dah kita pada era pandemik endemik ini, walaupun sudah diberi kelonggaran, kami still setuju untuk tidak menggunakan mask dalam flight sebab kita dalam flight ya sebab dalam flight adalah compressed air, so ia boleh memberi risiko kepada orang yang berisiko seperti warga emas dan kanak-kanak untuk dijangkiti melalui udara di dalam flight tersebut.
Face mask tu masih wajib dipakai lah sebab kami sih setuju mesti dipakai lagi sebab penyakit tu pun masih juga belum luasa, belum lagi totally conquer penyakit tu. And also pakai face mask tu bagi kami dah selesa dah macam kewajipan harian dah mun pergi tempat yang ramai orang apa semua. This is much more better lah tu pakai face mask tu.
Rasa sih setuju lah sebab ya kami rasa kita perlu cautious git lah dengan penyakit-penyakit dari orang yang si kisahlah COVID lah apa moon flu pun ataupun general sickness pun boleh jadi punca juga mesti dipakai mask.
The Kude fire tragedy earlier today had caught the attention of Sato Assemblyman Dato Ibrahim Baki as he doles out aid to the Kampung Kude Baru fire victims. The donations were in the form of food baskets and financial aid were presented during his visit to the site. The aftermath of the incident left 2 victims currently being placed in the hospital's red zone.
Sarawak Fire and Rescue Department spokesperson said the incident occurred around 9:35 a.m. and 2 wooden houses were gutted to the ground while a third house was partially damaged. Firefighters from Batu Lintang, Padungan and Putrajaya stations carried extinguishing works at the scene after receiving an emergency call. The flames were brought under control around 10:50 p.m. and the extinguishing operation wrapped up at 11:05 p.m.
Thank you for staying with me. Meanwhile, it has been a struggle for a married couple who currently have minimum source of income to nurse their 3-year-old daughter's heart disease. Rebecca Ryan Robson is suffering from supracardiac total anomalous pulmonary venous drainage and large unrestricted atrial septal defect. The couple, Robson Benedict Grunsin and Farina David, said that Rebecca treatment cost is too expensive, to which the family couldn't afford the treatment, estimate to cost around 35 to 40,000 ringgit, as the family has to rely solely on the father's income as a mechanic.
Rebecca was diagnosed with a heart disease after she was admitted to the hospital for influenza A pneumonia on August 4th till 15th.
Masa bulan Ogos masa budak-budak kena batuk kronik, masa itulah saya tahu dia ada sakit ni. Jadi masa tu saya hantar dia pergi klinik Tudan lah. Jadi masa itulah mereka orang transfer pergi Hospital Miri dan doktor dekat sana yang suruh dia lakukan scan jantung dan juga X-ray. Jadi ke sana orang nampak ada sesuatu yang sudah bengkak macam tu. And then orang suruh dia scan jantung semua tu. Scan tengok jantungnya tu memang ada berlubang. Lepas tu sudah ada macam bekas-bekas macam tu. Sebab sudah macam benda tu sudah lama
Farina pointed out that doctors at Miri Hospital have suggested for Rebecca's case to be referred to the National Heart Institute or IJN for surgery.
Doktor sarankan kalau boleh jauhkan dia daripada orang yang ada batuk kronik macam tu lah. Sebab kalau dia terkena macam batuk kronik macam tu kan, saya kira lah budak ataupun orang dewasa memang dia akan ter-efek yang macam dia ni lah. And then dia akan, bila dia kena macam ada orang batuk kronik macam tu kan, kena dengan dia, memang dia akan masuk yang tidak berhenti-henti macam tu. Dan dia punya pernafasan tu nanti memang akan lain daripada orang. Dia macam laju macam tu lah. Jadi bila dia kena macam batuk-batuk macam tu, so tekanan oksigen dia tu memang akan down lah. Sebab separuh daripada jantung dia tu saja yang menerima oksigen yang sebenar. Jadi yang separuh lagi itu kalau ikutkan jantung itu perlu menerima sepenuhnya oksigen dengan darah baru macam tu lah.
Therefore, appeals to the members of public to fund Rebecca's medical treatment. Donors can make their contribution to Sehati Service and Information Centre, Alliance Bank account 1102 7001 0015 028.
The treatment costs for heart disease will rise if no immediate action is taken to control and prevent the disease. According to the Health Director General, Tan Sri Dr. Noor Hisham Abdullah, he was citing a report of the 2022's direct healthcare cost of non-communicable diseases in Malaysia that during 2017, an approximately 3.93 billion ringgit from a total of 9.65 billion ringgit was allocated to treating heart patients.
Noor Hisham stressed that collaboration between the Health Ministry and other agencies, governmental or private sectors, are vital for heart disease care and prevention. The collaboration would also strengthen the governance of said care and prevention with much more comprehensive. Noor Hisham explained that cardiovascular disease is the leading cause of death globally, which causes more than 18.6 million deaths annually. But out of the total, 85% were caused by heart attacks and stroke, involving most low and middle income countries. He also urged that parents and children to adopt a healthy lifestyle that would decrease a person's risk of various diseases. He said this in his welcoming speech at the launch of the World Heart Day celebration on My Health Portal's Facebook page today.
And now on to world affairs. Up to 15 people are still missing and 3 are confirmed dead after a bridge collapsed in the northern Brazilian state of Amazonas on September 2. The Amazonas Fire Department said that it was looking for as many as 15 people after the collapse of a bridge on the BR-319 highway in the city of Carreiro, about 100 kilometers from the state capital, Manaus.
The department added that another 14 people were injured in the collapse that occurred as some vehicles were crossing the bridge. Local media outlet quoted multiple witnesses as saying the bridge had a crack that had caused a traffic jam before the collapse. Due to the collapse of the bridge, locals were forced to cross the rivers in canoes. The state government did not immediately respond to a request for comment.
See the world closer with TVS as we bring you the latest news updates both locally and internationally. Just head on to our official website at tvstv.my or follow us on our social media platforms. That's all the time we have for TVS Nightline. I'm Shol Shamato. Thank you for watching.